Hi, I'm JP Paluskiewicz, and thanks for watching this Healthy Byte. Last week, the House Ways and Means Committee held a hearing on telehealth. We wanted to take this opportunity to talk about the issue. This is already the second hearing that the House of Representatives has had on the issue of telehealth, specifically focused on expanding the service within the Medicare program. Telehealth has always been a wildly popular issue in the halls of Congress, and certainly the hearing in Ways and Means showed that continue to be true. Certainly with COVID-19 as a backdrop and so many people receiving their care over the last year and a half virtually, this is going to continue to be an issue. Historically, though, even though members of Congress didn't just get interested in telehealth with COVID, it has been very difficult to expand the benefit, particularly within the Medicare fee-for-service program. One, it has had an issue with the Congressional Budget Office. Typically, CBO has scored expansion of telehealth as a coster to the system. That is largely because of assumptions that the telehealth benefit would be additive and not replace in-person care. During COVID, though, those assumptions have changed as seniors have looked to avoid care sites where they might get infected. This has allowed an opportunity for telehealth to expand and for us to be able to collect data in a way that we have never been able to before, and challenge some of those long-held assumptions by CBO. There have also been concerns with congressional support agencies, such as MedPAC and OIG, on everything from how the benefit would be designed to concerns over waste, fraud, and abuse. Those concerns were again discussed during the hearing. But COVID again has kind of changed everything. One, we've been able to see what a telehealth benefit throughout the Medicare program might look like. Two, it has been able to pair with authority Congress previously gave Medicare Advantage to provide similar benefits back in 2018. This has now created a universe of data for Congress to pull from. Going forward, it is unclear if those same old problems will raise their heads as the public health emergency eventually wanes. That said, I do believe Congress will take this opportunity to create a bridge. I don't think Congress is going to look to disrupt patient care. There have now been seniors who have received their care for the last year and a half, whether it be their medication therapy management or their diabetes education virtually, and have quite enjoyed it. And I don't see them wanting that to turn off like a light switch. And so Congress, I think, is most likely probably going to embrace a bridge policy to give them some time to separate from the public health emergency and review the data to allow agencies like MedPAC and OIG to further give their thoughts and inform what a permanent fee-for-service benefit might look like. There is certainly interest in the House, and the fact that there have been already 2 hearings just this Congress alone shows that this interest is not going away. Jane, would you like to talk about the Senate?
Sure, thanks, JP. There is similarly strong interest in telehealth in the Senate as well, and your comments about bridge legislation are right on point. Just this week, there was the Connect for Health bill that was introduced in the Senate, and there's already companion legislation in the House. This bill has 50 bipartisan senators looking to advance legislation that expands telehealth access in a variety of ways and makes permanent some of the flexibilities that were available during the pandemic by giving the Secretary of HHS additional discretionary authority over telehealth. In my mind, the most likely path for these telehealth provisions to become law are for some of the provisions in the Connect for Health Act and other telehealth provisions that are circulating out there from other members of Congress to advance through the committee process. To have half of the Senate on record in support of this is a significant message to the committees and to the leadership in both chambers. This group of legislators have collected support letters from more than 150 organizations, and that number is growing. This is a thoughtful and engaged group of staff and members working to advance the ball on telehealth, and they've been doing this before the pandemic. This just adds fuel to the fire. I think that we can expect committee action in the Senate as well. The Senate Finance Committee is the committee of jurisdiction in the Senate, and they're interested in this subject. They've been thinking about telehealth policy for a long time, and the next steps for them would be to have a hearing as well. Bob, as we think about next steps in telehealth policy, what are some of the concerns that committee staff and legislators will think through?
Sure. Thanks, JP and Jane. As my colleagues have indicated, there's a great deal of support among members of Congress and, of course, the provider community for we're expanding and making permanent some of the regulatory relief provided during public health emergency. That being said, there are still significant concerns, especially among the professional staff at the key committees of jurisdiction, that will very likely have to be addressed before Congress decides how to move forward. First and foremost in the minds, particularly among Democrats, is the potential for exacerbating racial health equities. That really kind of falls into two buckets. Large portions of the country lack access to broadband services. And while there will be attempts to address this in the upcoming infrastructure package, that's likely to take years to fully unfold. In addition, there are many poorer families that simply don't have the resources to own the technology necessary to access a video appointment. So there are concerns among key committee staff that we'd be creating a two-tier system as we expand telehealth, one where families with wealth are able to access video, higher quality video appointments, whereas poorer families are stuck, using only audio only, and that's a real concern. The second one is condition specific. As JP referenced, there are concerns that providers may be nudging patients toward telehealth for services where it's not really indicated or effective. We saw a piece of this toward the end of the year in the 2020 year-end package, where Congress did approve making permanent the regulatory changes for mental health services. And that was a bucket of services where Congress looked at it and said, yes, we're comfortable and ready to move forward here. But we could see a great deal more of that moving forward, where the committee staff is taking a very close look at specific conditions and deciding whether telehealth services are appropriate for those. And that's going to take time. Third are the general program integrity concerns that JP referenced. And as we move out of the pandemic and into more normal circumstances where patients are more comfortable accessing in-person appointments, our telehealth appointments going to simply be additive and add cost to the system without really providing that additional benefit to the patient. And last but not least, as it always is with these kind of issues, is payment. During the public health emergency, there has been payment equity for telehealth appointments for providers. And there's going to be real questions going forward as to whether that will be maintained, particularly when you start looking at audio-only appointments, where there's concerns that that's just not the same level of services required nor the benefit to the patient. And so that'll be another concern that committee staff will be really digging into and fly-specking. And so, as was referenced earlier, kind of two things are true here. One, the genie is out of the bottle with regard to telehealth, and we are not going back to the pre-pandemic days in terms of how telehealth is utilized in healthcare. That being said, there are a lot of important questions that have to be answered, and it's going to take time to really kind of work through all these, and lawmakers and key committee staff are really going to want some data post-pandemic to see how telehealth functions during more normal times before deciding exactly how we're going to move forward. So stand by. There's going to be an awful lot more activity in Congress on this issue over the next few months and likely into 2022. And we will be back with updates as necessary. So thank you very much for your time.